Hey everyone, Interim Dean Nick Pace here, and I am in the Barkley Center with Emma Conradi. Nice to meet you.
Nice to meet you.
Thanks for making some time. Tell us about what you do here, what your major is, and how you came to be here.
Gotcha. Yeah. So I'm a first-year grad student in the Speech-Language Pathology program here. I do research. That's how we connected. I do research.
I got to come to this research slam.
Mm-hmm.
Okay, so we'll talk about that.
Yeah. So I'm in the UNL Learning Lab. That's where we are for intellectual and developmental disabilities. And this is I'm a research assistant here, so a graduate research assistant within the program. Yeah.
So what does a graduate research assistant? What's that mean? What do you do?
So I work
under
Dr. Susan Lovall, and so I'm just her assistant in the lab, but I'm also doing a thesis. So that was what I presented at the research slam.
So if I come over here at a random time and see you in the lab, who are you working with and what are you working on? Yeah,
so I'm working with a lot of undergrads. They're just doing undergrad research to build their resume for grad school. Okay. And then we also have some doctorate students that are working in here on their dissertation.
Okay. And what kind of impacts or what type of skills or what kind of discoveries are you making with students and children and learners?
Yeah, so we work with individuals with intellectual and developmental disabilities. Okay. So I'm currently focusing on individuals with Down syndrome, but we also have some other studies on kids with autism and just other IDD.
Okay. And what pulled you in this direction? Did you always know this is the kind of work that you want to do and explore folks with developmental disabilities and intellectual challenges? What brought you here?
Well, I love speech pathology and I wanted to build my resume for grad school. So that's how I came to the lab, and then I just found a passion for working with these kiddos. Okay. And yeah.
Are you that person that as a, fifth grader or second grader was playing school or playing scientist or?
Pretty much, yeah. Playing teacher. And then I wanted to be a doctor at one point, and then speech pathology is like the happy medium between both of them because, we're working with kids, work with adults, we can work in healthcare, we can work in schools, we can do it all. So.
Right. Okay. And so I attended the research slam, and you did a terrific job, and your colleagues and your classmates chose your presentation as the presentation of the day, and you were the winner. Tell me again about your research and what you found and what excites you about it.
Yeah, so I'm specifically looking at individuals with mosaic Down syndrome, which is a certain karyotype of Down syndrome. They have 3 different types, and it's a rare karyotype. So a percentage of their cells have the extra 21st chromosome. So it varies between individuals. I'm just looking at their language and reading abilities. And since I'm just a first year, I haven't really dove into my research yet, but we're seeing that it varies between those with full trisomy 21.
Okay.
Then, yeah.
And so what, with the hands-on experiences that you have here at the Barkley Center in the lab, working with folks, when you walk out of here and say, gosh, that was a great day, what's a great day in the lab for you look and feel like? What happens to make it a great day?
So we don't have any active participants in the lab right now. So more so clinical side in grad school. I see a client. My client comes twice a week, and then I also have an off-campus placement. So I feel like that when I have a good day with my client, a good session, that's when I go home and I'm like, okay, that was great.
Walking in here, you said that you had an unexpected scheduling session today, and so you grabbed some materials and kept working on your plan. What's a day look like for a session?
Yeah, so I right now have a 4-year-old with autism. He's bilingual and uses an AAC device. So we kind of best of both worlds going on. But yeah, I just grab materials and I do child-led play-based sessions. So I just let him take control, and then I follow him and try to elicit language that way. Okay. So, and I'm also bilingual, so it was really cool to be able to see that I can use my English and Spanish with him to elicit language.
Okay. And so tell us a little bit about the Barkley Center, because we talk a lot about how, this is certainly one of the best university-based clinic spaces anywhere in the country. What is special about the center and where you get to do all your work?
Yeah. Well, we get clients right off the bat, which is something that's super unique that most other universities don't do. Usually you like take a few semesters to like learn the material and then you have a client.
Hands
but here,
right away,
they throw you in, you have a client right away.
Okay.
The supervisors are there to help you, but they're also like, okay, you need to figure this out for yourself. So we make our objectives and then we make our therapy plans. And yeah, it's very hands-on right away, which is so cool. And it's also awesome how like our supervisors are very kind people, and they also like they're just there to help us. So they're intimidating a little bit, but they're also very supportive, which is awesome.
So over time, when you're seeing growth in your clients and improvement and goals met, how's that feel?
So rewarding, especially as students. Like we're not official clinicians yet, so it's
but you
so
can
cool
see progress over time.
Yeah,
tells you you're in the right place.
And just like little wins, especially with our little clients, like it's very rare to see a lot of progress with them right off the bat. So it's like so rewarding when we see them having progress and see that we do know what we're doing.
Right. So you studied communication disorders as an undergrad, stayed here at UNL for grad school. And when you finish, school setting, medical setting, private practice, what are you thinking? What are your options, or do you know?
Yeah, I don't know yet. I love early intervention, like the birth to 3.
Okay.
I'm in the MPUP program here, so I have to work with at least 50% of my caseload kids with disabilities for 4 years after I graduate. So definitely will be somewhere with kids for a little while. I'm not sure if that'll be in the school or early intervention or private practice, but
so you're not even leaning one way or the other.
No, yeah, just see where it takes me.
Okay, I got it. What advice would you have to someone who maybe is interested in the kind of experiences you're talking about, but who doesn't know maybe what a speech-language pathologist does, or what the nature of the work is? What's great about it, and what would you tell someone who's, that sounds kind of cool?
Well, I would say look online. There's a lot of stuff you can do. You can look into like sessions online and observing. We have just some basic classes here. I know there's like an intro to speech pathology that you can take in the undergrad level just to like get a grasp of what like the clinical side is. Ask people. We have such a great program here. I know Jill is always open to talk to anyone that's interested. And
As you think about the work that you're doing with your classmates and the relationships that you've formed with folks, whether people are focused on, schoolwork or clinical settings or medical healthcare settings, as you think about your colleagues and your classmates, what couple of words would you use to describe your group, and what are the words that describe people in your field, and what would you say?
I'd say we're all very supportive. We're very kind people, because you have to be very kind to be able to work with so many populations. You have to be patient, you have to be organized, driven. I'd say that's a good word too. We're all very passionate about what we do. And everyone that's here wants to be here, which is so cool to see.
10 years from now, what do you think you're doing?
Hopefully getting my PhD. I'd love to be doing research full time.
Okay.
But
you had a great start.
Exactly.
Right?
Yeah.
Because you're hands-on already, winning recognition from your classmates for your research.
Yeah.
Okay.
So we'll see where the wind takes me. But I do want to work clinically for a little to get that experience, and then be able to take that clinical side into hopefully doctoral program. And
Awesome. Well, thanks for staying here for grad school. And I hope maybe we'll see you back for what's next.
Yeah.
Awesome. Congrats.
Thank you.
Have a great break.
You too.